You're listening to a Raconteur Studios podcast.
Hello, lovely listeners, and welcome back to another episode of the After Our Skin Clinic with me, Dr Emma Craythorne. I'm a consultant dermatologist, and I'm joined by my colleague, Dr Ellie Rashid.
Hello.
In today's episode, we're going to be talking about botulinum toxin and the secret uses of Botox. Before we jump into today's episode, if you're enjoying these shows and love what we're doing here at the After Our Skin Clinic, would you mind doing me a big favour and clicking subscribe? We're still pretty new to the podcasting world, and it really helps us grow and reach more listeners just like you. Your support would really mean the world to me and the team here. Okay, let's dive in. It really is something that we treat so many patients with in our clinics, but actually outside the clinic, I would say it's probably the number one thing that people ask me about at the school gates, at the dinner parties. Do you have Botox? What's Botox like? Yeah. Can you spot people when they have it? Are you the same?
Yeah, all the time. People want to know if I've had Botox. That's the biggest thing that I get asked. And then they want to know if they should have Botox. And then they ask if I can do their Botox. That's often the order it goes in. Have you had Botox? Do you think I need Botox? Can you do my Botox?
And the answer to all three is yes.
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 It's still a little bit of a taboo subject, don't you think?
I think less so though now. I think so many people have had it done, and what we'll talk about are all the other indications for having Botox done. So I think less and less so.
Yeah, I will still see people who, will not want to tell their group of friends that they've had it or feel embarrassed about having it. Perhaps they want their partners to know about it, or, people that I know that I've treated who quite openly say, I don't have any Botox.
People are quite proud. They wear it like a badge of honour.
Yeah.
I've never had Botox before. I think Botox is quite a nuanced thing to do, and there are different ways to achieve a look, and so it just depends on the type of look that the person wants, and you can do it quite delicately and in a way that means that you get natural results without looking overdone, over frozen.
And one of the most amazing things about, and why I called it a slightly miracle medicine, because it has such effects on lots of different cells within the body. Its use in wrinkles, as we think of it, is probably one of the most boring aspects actually of Botox, isn't it?
Yeah, use it for all sorts of different things. But people just seem to know it as a thing that you give to relax muscles and to make someone's face freeze.
The first question people always ask is, well, what is Botox or botulinum toxin? And we'll use these terms interchangeably because it's a bit like a Hoover and a vacuum cleaner. They're kind of interchangeable terms. And we're not sponsored by Allergan in this podcast, but we are using the term Botox. But when we think about botulinum toxin, how exactly is it working in the skin?
Yeah, so botulinum toxin, it's a protein that's made by a bacteria called Clostridium botulinum. And that protein, it blocks a messenger chemical called acetylcholine from the nerves to the muscles. So when acetylcholine is released, the muscle contracts in response. And so what botulinum toxin does is it inhibits or blocks that acetylcholine release. And so it prevents that muscle from contracting and therefore relaxes wrinkles that are as a result of muscle contraction. If we're just talking about it in the context of using it to relax wrinkles.
And the thing that I just love about it as well is all of these other, what we think of as non-neuronal uses of botulinum toxin. So by that, I mean things that aren't just involving this acetylcholine. And that's where it actually is having these direct effect on glandular cells. So we use it for things like sweating. We use it for oily skin, which we can kind of come on to. But even it works on certain substances that are related to pain. So it can control pain for some people. It works around the vessel wall. So we can use it to inject for people who have problems with flushing or vascular issues like Raynaud's phenomenon. It really is such a useful chemical,
It can be used for indications outside of dermatology, which we won't talk about, but things like an overactive bladder, for sort of movement disorders, for a whole host of conditions within neurology. So dermatology, neurology, urology, lots of specialties will be using Botox.
One of the main reasons we typically use it for is for treatment of photo damage. So this is a medical condition where people's skin have become damaged because of ultraviolet radiation or other oxidative stress responses. And then the collagen gets damaged, and then you end up with lines and wrinkles appearing. But those lines and wrinkles are worse in areas where you have that muscle movement. So we think about the frown lines, so the glabellar area. We think of the crow's feet, which are around the eyes and they come out laterally from the sides. We think about it on the chin, you get that wrinkling of the chin.
Yeah.
And we think about it on the actual neck as well. So these areas really show whenever there's been increased muscle movement and you've got this damage from ultraviolet radiation, those two things together are causing these lines and wrinkles to appear, which is part of a medical condition, isn't it?
Yeah, it's part of a medical condition. And the lines that we don't treat, so it's normal to have dynamic lines. When you're making an expression, your face moves and therefore you get lines. But those don't tend to be the things that we're treating. We tend to treat those lines that are there at rest. So the ones that remain there, and they're the ones that can respond really well to Botox. So mostly people that have undergone a period of time where they've had enough sun damage or they've walked planet Earth long enough to develop those. So I'd never be injecting Botox into a young person.
No.
Ever.
No.
No.
I mean, I remember back about, well, it was just over 20 years ago when I was at the time doing a head and neck surgery job, and my friend Mira, who's a dentist now, an amazing dentist, the two of us, because of this head and neck job I was doing, decided to learn how to do botulinum toxin injections.
On each other?
No, we went to
fine,
a course that was set up. It was actually Sandeep Cliff was running the course for Allergan at the time. Yeah. Really, this is like more than 20 years ago. And so that's where we first learned how to inject botulinum toxin for our patients. But at the time, if you were doing this for wrinkles, the look very much was that you didn't have any movement.
Yeah.
And people had
That was the
very
fashionable look.
shiny foreheads and really no movement at all in the frown lines and almost quite expressionless, which is really, that has very much gone out of fashion now, and it's more about having expression lines, but they are just
Softer.
softer. And what did you think about this trend, again, years ago, where people would go, okay, it's going to cost this much to have one area of Botox done and this much to have two areas done?
Yeah, I think the 1, 2, 3 area thing isn't the right thing to do, because ultimately you want to harmonize the face, you want to create balance and symmetry. And so if you're relying on the patient telling you, I want just one area done, then the other areas potentially are going to compensate, and it might cause more imbalance of the face, and the overall look won't be what the desired outcome is. So I just think that we should be able to assess someone's face, see what the needs are, and then be able to inject Botox cleverly placed in a nuanced way to be able to achieve the best overall outcome. So yeah, the 1, 2, 3 area thing, I'm not a fan of.
I completely agree. And that's what I'll say to people whenever they're asking me at the school gates or whatever.
Yeah.
I'll say that idea of thinking about it where you're just going to treat this one particular area, it's almost more of a cosmetic way of treating it, really, isn't it? Or an aesthetic way, rather than thinking about that global skin health and trying to improve the health of the skin. When if you inject a muscle at one side, quite often the other muscles can compensate for that, and even the end of the muscle that you might have injected starts to almost then quiver a little bit, so you get a hyperactivity of it. So it is definitely about this harmonizing and treating the face as a whole, as opposed to just blocking out one area. But that was the trend 20 years ago.
It was really trendy, and to look completely frozen was so trendy. I had Botox done when I was in my 20s. I'd just finished medical school, and it wasn't ever an issue at medical school, but I had it done in my armpits for excessive sweating, so hyperhidrosis. And when I was a house officer on the wards, you know what hospital's like? It's boiling hot. And so I was on the wards and just was getting really hot and sweaty, and I was very conscious of being hot and sweaty. And then, of course, that would set off this whole cycle. So I'd get even more hot and even more sweaty. I was sort of taking my top off, drying under the dryer in the toilets. Total nightmare. So then I just thought, well, let's just sort it out. So I had Botox, and it completely sorted out the sweating. But what it really sorted out is my response to being sweaty. And I only had it a few times, And then I just found I didn't really need it anymore.
Yeah, you do see that, don't you? I do have some patients that happens to. And even I think in some patients where they've had a really overactive frown line, for example, treating just a few times to try and relieve the headaches that they might get from migraines or whatever, just treating that, then a bit like you've said, it's your response to it. It just doesn't behave in quite the same way again.
You just stop worrying about it. You stop thinking about it.
It reminds me a little bit of when you talked about sweating. Do you remember that study that was done in postmenopausal women who were flushing and getting hot flushes every day and also sweating, like you say? And they injected 30 of the group with botulinum toxin around the head and neck area. And then the other 30 they injected in exactly the same manner, but they injected saline instead of using botulinum toxin. And then they measured their response of how many of them had reduced their hot flushes and how many of them had reduced the amount of sweating they were getting. And they found out that at 2 months that there was this huge reduction in night sweats, general sweating and hot flushes in these postmenopausal, perimenopausal women. And that then in return meant that they were sleeping well at night. So their mood was so much better the next day compared to the control group that continued to have these night sweats, continued to have poor mood and continued to have hyperhidrosis. So it's so interesting that you say that about your sweating and then you relate it to this group of people. But then even more interesting was that 6 months out, which is well after the time that the Botox would have been working, they're still better from their hot flushes and their sweating and their mood, even though that's past the time of which it would have worked. So you're right. It's
You've
your
sort of broken
response
that
to it.
cycle. You've broken that. And particularly with a hot flush, you're very conscious that you're having a hot flush, aren't you? Like, when my mum's having a hot flush at home, she's really aware of it and that she's gone bright red and, let's open up all the windows. I'm feeling really hot. But I think once you've treated that, and you know that that's, it's not so visibly red to everyone, you're then not responding to that with the emotional response.
Yeah.
And so the whole thing just sort of settles down and calms down.
Yeah, because your emotional response then makes it worse. You're like, am I sweating? Am I
Yes.
red?
Yes.
Yes. Okay, I'm now sweating even more. I'm now even more red.
Exactly.
Do you use it as well a lot in your patients for that flushing of rosacea?
Yeah, so used it today for rosacea flushing. I think it works an absolute treat. I mean, of course, you've got the other treatments that you'd give for rosacea. But yeah, I think micro Botox, cleverly placed in the areas where you're getting flushing, can work really well.
Yeah, I completely agree. I almost have it as standard, really, as part of my treatment package for patients with rosacea. And actually, especially patients with rosacea who are also perimenopausal, menopausal women. It really is.
The age group.
That is the age group.
That's the age group.
And then for those patients who have rosacea, that's what we call, the neurogenic type, where their face is so painful. And because Botox has this amazing effect on certain pain substances that we have within our skin, it really reduces down the pain for them as well. So that's why I sometimes say it's magic, because it helps with the pain, it helps with the reduction in the redness, as well as the flushing.
Yeah, a patient with rosacea that I had today, that was exactly what she's talking about, the burning sensation that she's getting. It's not just being red, it's just the discomfort that she's feeling. And the way that botulinum toxin works on these receptors in the skin that signal pain, so it really reduces that pain signal going back to the brain. It's genius.
I know. And it's not even just on those nociceptors, those pain receptors in the skin. The effect that it also has whenever we think in our patients who make too much oil, or something called seborrhea. I remember whenever this first came out, I saw it in a meeting, 10 years ago. And I remember thinking, no way does putting in botulinum toxin make your skin less oily. That doesn't work. I was somebody who'd always had quite, dryish skin. And I'd never noticed my skin become more dry whenever I'd had Botox injections. But then the studies kept coming. And I thought, really? And the most interesting thing about it of all is the clinical studies show that when used on patients who have oily skin or making too much oil, this condition called seborrhea or hyperseborrhea, then it reduces the amount of oil produced from those patients. But in patients who have normal skin or drier skin types, then it doesn't affect the oil output at all.
I treat men with seborrhea with Botox quite commonly.
And it
particularly around the sort of mid-face.
Around the mid-face, just under the eyelid skin area to help blend it in, because often you get that kind of panda look, don't you?
Yeah.
I love it. And, you do get an effect then on the size of what we think of as pores, but they're not pores, they're the openings of the hair follicles, but they become smaller. So it's such an interesting way and such a clever way this molecule works on those sebocytes too, isn't it?
Yeah. Genius.
One of the studies that blew my mind as well, and you maybe want to talk about this one, is the fact that, and these obviously are all off-license treatments, we're quoting kind of from studies and things that we talk about after hours in the clinic, because this is how we spend our evenings, just chatting. But the ones that I love are those studies showing the use of botulinum toxin for people with depression and treatment-resistant depression. And it all stems from the Darwinian theories, really, of if you frown, then you're more likely to feel a negative emotion. So the more you frown, the more likely you are to feel a negative emotion. And almost, just put a smile on your face and you'll be happier. You genuinely are happier if you put a smile on your face. And so tell us about the botulinum toxin studies for those.
Yeah, so this was a study looking at 30 patients where half were treated with botulinum toxin and half were treated with placebo. They were treated in the glabella, so the area in between your eyebrows.
The frown.
The frown
The grief lines they used to be called, isn't it?
Yeah. And the patients that were treated with botulinum toxin in their glabella had a positive response in terms of treating their depressive symptoms compared to those that had placebo. So even though it's just working in those areas, it's working on that expression of a frown, it has a long-term benefit on how they feel and that emotional response, because they're unable to create that negative emotion response.
It really is amazing.
Yeah.
Whenever somebody does say, put a smile on your face, and you do have that smile on your face, you do feel better.
Well, there's laughter yoga now.
Is there?
Yeah.
I actually think I knew that. Have you ever done it?
No.
I think
it just makes me laugh thinking about laughter yoga. What you need to do, use botulinum toxin, get rid of all the negative emotion, facial movements, and just enhance all the positive, smiley ones.
I suppose one of the other uses I've started to have with botulinum toxin in my clinic is with its use in scarring. So particularly hypertrophic scarring, which is a scarring where you've got a bump on the skin so it sticks out. Or in keloid scarring, where you have a bump on the skin, but the scar just keeps getting bigger and bigger. Now, it's not useful for very big keloid scars. This is talking about smaller keloid scars where you can actually get a needle into them, and that's probably the depth of the scar. But what was quite interesting when they did this big meta-analysis looking at all of the studies of how best to treat keloids, botulinum toxin came out pretty high up as an injectable treatment, like the equivalent of steroids.
Yeah,
I've
used it in the context of a patient that's keloid prone, had a mole that needed to be removed, and was inevitably going to get a keloid from that surgery. And so what we did is I injected him with Botox and a steroid straight after the surgery. Absolutely perfect scar.
Yeah.
Like, no.
Where was this?
On his back.
On his back.
Yeah, which is where all his keloids had been from acne scarring. And actually has had a lot of treatment for the keloid scar. So I was really quite anxious about having this mole removed, thinking I'm just going to add to my keloid collection. But it worked brilliantly.
So I think the theory there is, number one, you've got this reduced attention, I suspect, because of the botulinum toxin acting locally, but also you've got this, which I regard as the most amazing effect of botulinum toxin, is the non-neuronal effect, where it is working directly on those fibroblasts. So directly taken up, influenced by the botulinum toxin is the fibroblast, and then it starts to behave and produce its collagen in a more normal way. So what I think is so cool is that in those scars that are big and thick, it makes them behave, to try and make it regular and small. But in people who have sun-damaged skin, where their collagen is also disrupted, the fibroblasts are stimulated to make collagen in a more regular way. it's a bit like the oil story. It's so cool. It can just bring things back to the center.
Yeah. It doesn't go too far to the other extreme. It completely just brings it back to normal.
Yeah, because you would think if somebody had sun-damaged skin with poor collagen and you give them botulinum toxin, okay, then they're going to make more collagen. But why would that work then for a keloid? Why would you then let it have even more collagen?
Yeah, it's all to do with the muscle tension, but also to do with the mechanical stimulus. So for patients that are keloid prone, usually there's a genetic component to it, but it's just the pathway within their skin that tells their skin to stop creating collagen, as in to stop the scar formation. That process doesn't happen. And so the scar just keeps forming with outside of the parameters of where the original trauma was. And so I guess what the Botox does, it must just regulate that pathway that's overactive.
Yeah. So that, and then the effect on those fibroblasts, it's amazing, isn't it?
Exactly.
Love it.
Love.
Botulinum toxin can be really useful for Raynaud's. So again, one of these examples of when you flush, you've got these vessels all dilated on your face. So botulinum toxin stops that from happening. But almost the exact opposite of that is somebody who has Raynaud's phenomenon. So whenever it's very cold outside, or cold actually anywhere, they can get a vasoconstriction of their fingers. And I have Raynaud's. I've always had Raynaud's. I remember my fingers when I was like maybe 9 or 10. I used to think of them that they died because they were so white. And I used to do little pretend cardiopulmonary resuscitation on each finger to try and bring it back to life. I can remember that out in the street with my friends going, in Ireland and it's freezing. Oh, my fingers have died.
Called double two.
I was always destined to be a doctor, clearly.
Yeah.
Trying to bring these back to life. But your fingers go pure white. So exactly the opposite of what's happening on the face in flushes and flares. But yes, so injections just at the base of the finger, and then the Raynaud's phenomenon is reduced. And it's really helpful in some people who it's quite restrictive if they're always in cold environments. But it can be really helpful for some people who have these connective tissue disorders where the Raynaud's phenomenon is so troublesome. It starts to break down the skin and things at the ends of the fingers. So it's helpful. So I have that done in the winter months, but it's not painful. It's just a normal little invisible needle injection.
Yeah. Palmar hyperhidrosis as well, excessive sweating from the palms.
Painful.
That's really painful.
Yeah.
But it's a lot of injections.
It's a lot of injections.
For the palm sweating. But I can see why people want to have it done. Like if you're shaking hands with someone, holding a pen, and it's a real issue. Actually, school children to hold a pen and like for exams and things, and they worry about it so much it just makes the whole problem worse. So some children for excess sweating of the palms will have Botox injections.
Yeah, and the same for the soles of the feet.
Yeah, slipping around in sandals during the summer months.
Yeah, it is an uncomfortable procedure for patients. I think it's also uncomfortable as even the doctor delivering the treatment because it is.
You don't want to see people in pain.
No, you really don't.
No.
You kind of pride yourself that you don't cause any harm or discomfort, but it is really quite uncomfortable. However, the quality of life studies show that it really does improve for those people who cannot hold a pen or hold their phone or drive without their gloves on. Makes such a difference. And I don't think any patients seem to think that normal botulinum toxin injections that you're doing for facial injections, that's a very tolerable procedure.
Yeah, most people can tolerate that completely fine. We've got a Persian expression, which is kill me but make me look beautiful.
We have a UK expression called no pain, no gain. But actually it's not painful.
No.
And there's certain things that you can do to make sure it's not. So you're using the finest needle, and I don't mean finest as in the most beautiful. I mean an incredibly thin needle called the invisible needle sometimes because it's so thin. So using it like that, delivering nice and slowly, delivering it into the areas that you want. It's targeted, minimizing the number of injections.
Talk the whole way through. Don't stop talking.
I think that's right. I think talking is so helpful, or placing your hands somewhere else on a patient's head whenever you're delivering the treatment.
Yes.
So just slightly pressing on the cheek whenever you're delivering it to the forehead. Is nice. I always do those distraction techniques whenever I'm, I've got a patient for surgery, and it's so helpful. So I don't think they're particularly painful.
I love the relationship with a patient that has Botox done because you see them every few months. And so you do just end up talking about their life. They confide in you, tell you everything. whilst you're delivering this injection.
I actually have it the other way round. I feel
You
like
talk-
I confide everything to my patient. I'll have people come back and say, oh, so how did you get on with that, whatever it happened to be? It's like, gosh, did I tell you all about that? I think they know everything about my entire family.
I know, I think they do too.
Every time my husband does something that annoys me. And that's a wrap for today on the After Hours Skin Clinic. We've always got so much more to chat about here and on the phone and in clinic, and you're just catching a little glimpse of it here. So if you enjoyed this episode and would like to help us out, then please do subscribe, and you can also leave us a review below. So until next time, take care of yourself and your skin. Please remember your SPF, and we'll see you on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.